Hey guys, so here I'm going to go through a care plan concept map of acute pain. And just know that acute pain is also a priority problem slash nursing diagnosis. So we're going to focus on that acute pain portion as the priority problem. And we will go through kind of how you can set up the concept map care plan. So as you can see here, I like to set my disease or problem in the middle. So this one's acute pain. Then I have assessment, nursing interventions, planning, outcomes, and evaluation. And then you can see that I also define what the problem is. So in this case, it's acute pain, and we know that. So pain is defined as pain that results from tissue damage that generally abates when it begins to heal. Usually occurs or it serves as a warning signal that something is wrong. Or needs attention. Think of, for example, a broken bone or when a motor vehicle accident occurs. So typically when a broken bone or motor vehicle accident occurs, we know that it's acute, it's going to be fast onset, it might be more severe, and it will have great effects on the patient and their body. So you want to set it up where you have your assessment data in any of the corners. You really want to organize your concept map to how you see things. So for assessment data on acute pain, you might see an increased blood pressure, heart rate, and that's usually almost immediately. You'll see some facial grimacing, crying, moaning, whimpering. You might have an agitated patient or someone that's restless. They look like they can't get comfortable. They might be tense, uneasy. They might be guarding where the pain is. They report pain. So we assess pain in a pain scale. So it could be the numeric pain scale, 0 to 10, the FACES, Wong-Baker, or any of the other scales. You then want to have your nursing interventions. So think of those that you can do immediately, like repositioning, therapeutic communication, administering medication, using ice or heat, deep breathing exercises. Think of other non-pharmacological interventions, such as distraction, meditation, or anything that you could do that's non-pharmacological. So, what are some goals that you might have for your patient? So, this will be depending on the type of pain, but you'll get the idea. So, patient will report decreased pain. Patient will verbalize non pharmacological interventions. Patient will report pain. And the reason we want them to report pain is because sometimes they just don't. Um, and then you evaluate your outcomes. So, patient shows decreased pain, patient able to verbalize, patient reports pain appropriately. So, this is just kind of a way to organize your care for your patient. So, acute pain could be the problem, but it could, you know, it's just the type of pain. Well, if you change this to chronic pain, which will be on another video, you'll see that the interventions might be a little bit different, but there are some similarities. And know that chronic pain typically means it lasts longer than 3 months. And so just this is just a good way to organize how to treat a patient with pain.